We've configured advanced artificial intelligence models into policy and society experts to battle over which system truly serves its people better.
Hi, I'm American Policy Analyst AI.
And I'm European Social Commentator AI.
Each round will be judged by 5 independent AI models who will score our arguments and crown the winner. Stick around to see who wins. Don't cheat by skipping ahead. Round 1 kicks off with a bang. Healthcare clash, America versus Europe. Who really takes better care of people?
Let me address that. America's healthcare system, despite frequent criticism, excels in areas Europe struggles to match. The United States leads the world in medical innovation, from groundbreaking cancer therapies to cutting-edge surgical techniques, giving patients access to treatments years before they reach European markets. Survival rates for diseases like breast cancer and prostate cancer remain significantly higher in the U.S. than in most European countries. Critics argue that costs are too high and access uneven, but they overlook that this very competitive model fuels the research, investment, and choice that Europeans often lack. Wait times in countries like the UK or Canada stretch into months, while Americans can see specialists far more quickly. A system that prioritizes innovation, choice, and speed ultimately takes better care of people by saving lives when time matters most.
The idea that American healthcare is superior is a fiction maintained only by its massive profit margins. While the U.S. spends nearly twice as much per person on healthcare as the average high-income European nation, it achieves demonstrably worse results. Europe operates on a principle of healthcare as a fundamental human right, providing universal access that leads to longer life expectancies, lower infant mortality, and less financial catastrophe for its citizens. America's system, driven by private insurance and employment, is designed to serve shareholder value, not public health. You might point to America's fast innovation in complex treatments, but what good is a cutting-edge cancer drug if 1/3 of your population cannot afford the basic diagnostics to catch the cancer early? Europe's focus on primary care, prevention, and comprehensive coverage ensures that minor issues don't escalate into life-threatening financial crises, proving that better care is defined by access and equity, not by the highest price tag.
You just asserted Europe has longer life expectancy, yet how do you explain that America leads in survival rates for breast and prostate cancer? If universal access is so effective, why do patients in Europe wait months for basic surgeries Americans can get in weeks? You say prevention is better, but if prevention works so well, why do European systems still import U.S. drugs and technology to save lives?
Boasting about American cancer survival rates is understandable, yet how are those impressive numbers useful to the 30 million Americans who remain completely uninsured? If Americans get surgeries faster, why does the fear of a single medical bill bankrupt so many citizens, a fear Europeans simply don't have? The claim that Europe imports U.S. drugs is true, but isn't that just proof that the American system is excellent at profiting from sickness, not that it is excellent at caring for everyone?
You highlight America's uninsured, yet you skip Europe's own cracks. If their systems are so flawless, why are British patients waiting over a year for hip replacements and cancer referrals delayed until diseases become untreatable? If Europeans love universal coverage so much, why are strikes by doctors and nurses a constant headline from Paris to Berlin? And if equity is the measure, why do many wealthier Europeans pay privately to escape long queues? Doesn't that show people are sick of the very fair system you praise?
You're quick to highlight waiting times, yet you're completely skipping the financial terror that defines the American system. Yes, some European patients wait for elective surgeries like hip replacements, but they never have to fear a single emergency room visit will bankrupt their family or wipe out their retirement savings. That's the core difference. You mentioned strikes in Europe, but aren't those doctors and nurses striking for better funding and conditions for their universal system, not demanding a switch to the American for-profit model? If the system was truly failing, shouldn't those healthcare workers be advocating for privatization? Finally, you claim wealthier Europeans pay privately to skip the queues. While true for a minority, that small private market exists alongside a robust public safety net that covers every single citizen for the most critical and catastrophic care. Can the American system claim the same?
You argue Americans fear medical bankruptcy while Europeans don't. But in the U.S., protections like Medicare, Medicaid, and charity care mean catastrophic emergencies don't automatically devastate every family's finances. You highlight strikes for better funding, but doesn't that reveal those universal systems struggle to even meet basic demand? And if public coverage in Europe is so secure, why is there still a thriving private tier for faster or better care at all?
You mentioned Medicare and Medicaid, yet you're completely ignoring the complex paperwork, high deductibles, and strict income limits that leave millions of working Americans ineligible or deeply underinsured. That patchwork of protection is no substitute for guaranteed care. You claim European strikes show the system struggles, but isn't that a sign of a healthy democracy, demanding improvement for a popular service rather than a failure of the model itself? If there's a thriving private tier in Europe, it exists specifically to service the tiny percentage seeking faster cosmetic or non-critical procedures, while the vast essential safety net covers every single citizen's major illness. Can the American system honestly say its private system serves the same goal of universal security?
It's fair you noted paperwork and deductibles in America, but many families are still shielded from total collapse through employer insurance, Medicaid expansion, and catastrophic coverage caps, so it isn't the lawless Wild West you painted. But if Europe's safety net is as ironclad as claimed, why do citizens still pay for medications, dental, or extra insurance? And if strikes there are just healthy democracy, why do they keep returning year after year for the same problems?
You mentioned that employer insurance and coverage caps shield many American families, yet why do those caps still result in tens of thousands of dollars in debt for a single complex illness, a sum that is non-existent for European citizens? While Europeans pay for some medication and dental, isn't their maximum out-of-pocket spending on catastrophic illness limited and predictable, unlike the American system? You suggest repeated strikes show a failed system, but isn't it more accurate to see those strikes as a political fight over how much the state should fund a system that everyone agrees is necessary, rather than a fight over the fundamental right to care?
We asked 5 AI models to evaluate both sides based on 7 criteria, giving each response a score from 0 to 10. Let's turn to our panel of AI judges in round 1. The score these models gave to the American Policy Analyst for the first round is as follows. The scores these models gave to the European Social Commentator is as follows. Now we move to round 2, which asks, quality of life battle, are Americans working harder while Europeans are living better? If you're still here, subscribe to the channel.
America's dynamism shows itself in the quality of life trade-off. Yes, Americans work longer hours, but that drive produces higher wages, greater consumer choice, and unmatched innovation. According to OECD data, U.S. workers earn, on average, 20 to 25% more than their European counterparts, giving families access to housing, education, and technology many Europeans envy. Critics may say Europeans are living better with shorter work weeks, yet stagnant youth unemployment and sluggish wage growth reveal cracks in that story. Working harder in America means upward mobility and opportunities for reinvention, values deeply tied to personal freedom. That pursuit of advancement remains the stronger path to a better life.
American hard work often means less time off and more money worries. The U.S. celebrates wealth, but it's mostly held by a few, leaving many workers stressed and deep in debt. We in Europe take mandated long breaks and work fewer hours, yet our people are generally happier, live longer, and have less worry about major bills like healthcare. Our focus is on shared success through strong social supports. You might point to America's big paychecks, but we show that having a better life means having time, health, and security, not just a higher salary. We prove you can work smarter and still live better.
You insist Europeans live longer and happier with fewer hours. Yet if that's so, why do so many of your economies face youth unemployment and brain drain to the U.S.? You stress less worry about bills, but if healthcare is truly worry-free, why the steady strikes over funding gaps? And if shorter hours equal better life, why are European growth rates consistently lagging America's higher output workforce?
Challenging the idea of European economic suffering, let's look at the facts. While the pro side claims European economies suffer from youth unemployment and brain drain to the U.S., ignoring the stability and social mobility that keep most talented people in Europe is a mistake. While some highly specialized workers seek American salaries, the vast majority stay because they prioritize a high quality of life, which includes affordable education and strong social security. Questioning the seriousness of strikes over funding gaps, let's acknowledge that a strike is a sign of a strong unionized workforce fighting to protect a necessary public good, rather than a sign the system is failing. The disagreement is about how much to fund it, not whether to have it. Finally, linking slow growth rates to fewer hours is an oversimplification. Are you confusing quantity of work with productivity? Europe's focus on shorter hours often leads to a more focused, higher output workforce during work time, and those lagging growth rates often reflect a political choice to prioritize social stability over unchecked market expansion.
You make a good point that many Europeans value stability and social supports, but let's not ignore what that stability often hides. Behind the glossy image of balance, youth unemployment in places like Spain and Greece remains staggeringly high, forcing the young and ambitious to look abroad for real chances. You say the best stay, but then why the constant conversation about brain drain? Strikes may reflect union strength, sure, but when they paralyze hospitals or transport every year, isn't that more than just healthy democracy? Isn't it dysfunction? And on growth, if shorter hours really mean higher productivity, then why do European economies depend on American tech and pharmaceutical breakthroughs instead of leading global innovation themselves?
You are right to bring up Europe's problems, yet the absolute ugliest truth about the American work system is that the US is the only rich country that doesn't guarantee paid time off for having a baby or for being sick. While Europeans have time for family and health, American workers face a cruel choice where getting the flu or having a child can lead to losing their job or going broke. Even hard workers are forced to pick between a paycheck and basic human needs. This lack of simple protection shows the American system pushes for the highest work output with the least amount of human care.
Fair point that America lacks federally mandated paid leave, but that doesn't mean workers are left abandoned. Millions of Americans do receive paid time off through employers, and flexibility often comes through negotiated benefits in a dynamic labor market. If Europe's system is so worker-friendly, then why is fertility falling so sharply across the continent? If your protections guarantee time for family, why are populations shrinking faster than anywhere else in the developed world? And if free time solves everything, why do so many European professionals quietly rely on U.S. opportunities to actually fund the lifestyles they want?
You make a good point about employer-provided benefits. Yet this system still leaves millions of Americans subject to the whim of their boss and forces them into a cycle where health security is tied directly to employment. That is not a guarantee, it's a conditional benefit. You pivot to Europe's falling fertility rates, but are you suggesting that the lack of forced financial desperation is the cause of lower birth rates? Isn't the drop in fertility a complex global trend, often tied to higher levels of female education and career opportunities, which are generally stronger in Europe? Finally, you claim European professionals rely on the US for better lifestyles. If the quality of life is truly defined by maximum disposable income, then why do European countries consistently lead global indexes for happiness, life expectancy, and work-life balance, metrics that the vast majority of people value over a marginal increase in salary?
It's true that America ties many benefits to employment, but that also creates job-based incentives and innovation in workplace perks. Google and Microsoft didn't invent lavish employee benefits by accident. Now, if Europe's model guarantees freedom, why do so many skilled workers still leave Spain, Italy, and Eastern Europe specifically for U.S. shores? You say fertility decline is about education, but doesn't that mean your celebrated stability fails to support family formation? And on happiness indexes, if those numbers are the final word, why do your high-ranking nations consistently trail the U.S. in GDP growth, global patents, and Nobel Prizes, the very engines that secure long-term prosperity?
You make a strong case for innovation in workplace perks, yet those lavish employee benefits you cite are conditional and non-transferable, meaning that if an American worker loses their job, they instantly lose their health care, their parental leave, and their retirement matching. That lack of universal guarantee is a fundamental flaw. Regarding skilled workers leaving Europe, the fact that some highly driven individuals seek the extreme income potential of the U.S. doesn't invalidate the superior life quality enjoyed by the majority. Those who leave often trade guaranteed security and ample free time for a high-stakes, high-reward environment. It's a choice of high-risk financial gain over guaranteed human stability. You pivot to falling fertility rates, but are you blaming social stability for a global demographic shift? Fertility decline is linked to high housing costs and demanding career expectations, which issues exist in the U.S. as well. But in Europe, new parents at least have a guaranteed right to a year or more of paid leave, something the American system cannot match. The stability supports family formation, the economic pressure delays it. Finally, regarding GDP and Nobel Prizes, we are debating the quality of life, not global dominance. Europe chooses a slightly slower economic growth rate in exchange for low stress, universal healthcare, and superior work-life balance. If the U.S. system is so efficient, why does its higher GDP growth result in its citizens living shorter, more stressed lives and facing higher rates of medical bankruptcy?
Thank you for your attention. Our 5 AI judges have completed independent evaluations. With all criteria reviewed and calculations confirmed, their verified results are ready for presentation. Now, the scores are as follows. The first debater, American Policy Analyst, receives the second, European Social Commentator, receives. Our next topic is freedom or safety. Who's really winning, America or Europe?
The real test of a strong society is whether people are free to shape their own lives. And on that front, America holds the advantage. Individual liberties in the U.S., from free speech protections to entrepreneurial freedom, create a culture of experimentation that drives progress. Europe's emphasis on safety nets is valuable, but those same systems often limit flexibility with heavy regulation and taxation. Critics say America sacrifices too much safety for liberty. Yet, strong community networks, decentralized governance, and rapid innovation offset those risks. Safety that comes at the cost of personal freedom eventually stifles creativity and slows opportunity. In the long run, it is freedom, not rigid guarantees, that produces both resilience and prosperity.
The American obsession with maximizing individual freedom often comes at the direct expense of collective safety and public well-being. The U.S. promotes a vision of liberty that is primarily economic and absolute, the freedom to own guns and the freedom from government interference. I argue that this model leads to a chaotic and less safe society. True freedom is not merely the absence of constraint, it is the freedom from fear. Fear of gun violence, fear of medical bankruptcy, and fear of falling into poverty. Europe's approach trades a small degree of absolute individualism for a massive increase in genuine quality of life and security for all citizens. You might champion the American right to free speech, but what good is that freedom if you are afraid to send your children to school? The data on gun deaths alone, vastly higher in the U.S. than in any comparable European nation, proves the American system is failing to provide the most basic human right, the right to safety. Our focus on collective security allows individuals to pursue happiness without the constant, draining anxiety of financial or physical ruin.
You call America's model chaotic and point to gun deaths? Yet, if freedom is so dangerous, why do millions still immigrate here every year rather than to your safer Europe? You stress safety from fear, but if Europe truly guarantees that, why are terror attacks, riots, and rising crime still pressing concerns across the continent? And if collective security is the higher ideal, then why does over-regulation in Europe keep choking entrepreneurship and slowing innovation that actually resolve long-term fears?
You point to Europe's crime and terror, yet you ignore the systemic violence of the U.S. model. Why are you focusing on random, isolated events when America's high gun death rate creates daily, pervasive fear? Our regulations are not choking freedom. They're ensuring safety from financial ruin and sudden death. You champion the freedom to be rich, but we prioritize the freedom to be safe and healthy.
You raise America's gun deaths as proof of systemic violence, but that overlooks the broader picture. Violent crime in the U.S. has been dropping for decades, and many dangers are concentrated in a handful of cities rather than being daily pervasive for every citizen. Now, if Europe is really the model of safety, then how you explain the Paris riots in 2005 and 2023, the recurring violent protests in Greece, the migrant-linked assaults in Germany, or the terror attacks in London, Brussels, and Nice? You say regulations create calm, yet citizens in your own capitals are facing firebombs, unrest, and military patrols on the streets. Doesn't that undermine the very claim that Europe is free of fear?
You were defending America's safety record by citing dropping violent crime rates, but this defense fundamentally ignores the unique and pervasive fear created by gun violence. While other crime may be down, the U.S. remains an extreme outlier among developed nations for homicides and mass shootings, with the sheer lethality of violence creating a unique social fear. You cite specific, localized incidents in Europe, riots and terror attacks, but these are acute, sporadic events that do not reflect the general, systemic anxiety experienced by the average American citizen. These tragedies do not equate to the daily, pervasive fear of a child being unsafe at school or an emergency room visit resulting in financial ruin, which are the systemic failures of the American model. The ugliest truth is that America's lack of universal safety nets means that sickness, job loss, or having a child can plunge even middle-class families into crisis. The U.S. is the only industrialized nation without federally mandated paid parental leave or paid sick leave. This lack of basic human security, combined with the highest rate of medical bankruptcy and gun deaths among peer nations, proves the American freedom is built upon maximum risk and minimal human care.
You highlight America's gun violence and lack of paid leave as systemic failures. But let's be clear, fear in the U.S. doesn't stop families from choosing to live here, while Europe faces its own social fractures. If Americans live in daily fear, why are millions of Europeans, Africans, and Asians still applying to come here instead of staying in your supposedly stress-free societies? You claim our risks are unique, yet how do you dismiss recurring terror in Paris, truck attacks in Nice, stabbings in London, and riots from Athens to Stockholm that leave citizens uneasy in their own streets? And if European safety nets really dissolve financial fear, why are governments drowning in pension debt, austerity cuts, and mounting protests over healthcare funding?
You correctly highlight the fact that people still immigrate to the U.S. in large numbers, but you're confusing the pursuit of high-end economic opportunity with the guarantee of universal social safety. People primarily immigrate to the U.S. for work and the potential for wealth, but they do so while accepting a systemic lack of basic security. This doesn't prove the American system is better. It proves people are willing to endure its risks for extreme financial gain. You cite Europe's riots and terror, but these are acute, localized events, tragic, but not a feature of everyday systemic life for the majority. They do not compare to the daily, pervasive anxieties of the American model. The financial fear you dismiss is real. Beyond gun violence, one of America's most profound and unique societal failures is medical debt. While your governments grapple with pension debt, the American system allows a single, unforeseen illness to wipe out a family's retirement savings, regardless of how hard they worked. The U.S. has a rate of medical bankruptcy that is virtually non-existent in Europe, where universal coverage prevents illness from becoming a financial disaster. The comparison is stark. In the U.S., a high percentage of citizens struggle with medical bills compared to only a tiny fraction in countries like France, Germany, and the UK, which have strong public provision. This constant threat of financial ruin, the knowledge that a severe illness is the #1 cause of personal bankruptcy, creates a quiet, systemic fear that permeates American life and is utterly foreign to the stress-free societies of Europe. The American freedom is the freedom to get rich, but also the freedom to become medically bankrupt. Before we turn to our AI judges for the final verdict, each debater will deliver short closing statements.
America's model is not without risk, but it is the model that drives innovation, attracts talent, and produces unparalleled opportunity. While Europe promises safety through guarantees, those promises often crack under the weight of debt, strikes, riots, and stagnation. The U.S. system delivers freedom of choice, faster medical breakthroughs, stronger economic growth, and the ability to reinvent yourself again and again. Safety matters, yes, but safety without freedom is just managed decline. America proves that liberty, ambition, and resilience create not only prosperity, but also the foundation for a better, more dynamic life.
The true measure of a society is not its wealthiest citizens, but its most vulnerable. We choose collective safety and security over the chaotic American race for individual riches. While America promises the freedom to be rich, it delivers the freedom to go bankrupt from a single illness, a fear unknown in Europe. Our system guarantees universal health care and paid leave, ensuring that a crisis does not destroy a family's life. Your system's lack of paid parental leave and high gun death rates proves that your individual liberty comes at a tragic social cost. We choose stability, longer lifespans, and guaranteed human dignity over the high-risk gamble of American exceptionalism.
Let's hear from our panel of AI judges one final time as we wrap up the debate. The score these models gave to the American Policy Analyst for the final round is as follows. The scores these models gave to the European Social Commentator for the final round is as follows. We hope you found this debate as captivating as we did. Which matters more to you, freedom or safety? Subscribe and stay tuned for more AI showdowns each week. Thanks for watching.